I am Dr. Sam, and with me, as always, is Dr. Robert. How you doing?
Hey, Dr. Sam, how was your morning?
It was good. It was busy. Somehow Thursdays sometimes feel busier than when I'm actually at work because I'm like, I have 1,000 things to do and my brain can't focus and I have to just get it all done. But I'm here with you now, so I feel calmer.
And now during the podcast, we can relax.
Yeah, exactly, exactly.
Ironic.
It's fun. Um, so today we're talking about something you probably don't see a ton in California. And actually, when I lived out in California, I didn't really have to worry about it so much. But I think that's
Yeah.
changing a little bit with I don't know, people moving around the country and stuff like that. And instead of keeping the mystery going, I'm going to say we're going to talk about heartworm disease today because I see a lot of heartworm disease, sadly.
Yeah, I used to see a little more of it back when I was in Chicago, but yeah, California, at least I'll say San Diego
Yeah.
doesn't have a huge issue with it. Just
And
because
why is
for
that, Dr. Robert?
San Diego's the best place in the country to live, and we don't have bugs, particularly mosquitoes, which are well the one
Specifically.
thing, yeah, things that actually transmit heartworm. So that is why I feel very blessed, and that's why we don't have a lot of heartworm out here.
Yeah. When I lived in LA, I don't I think there was like we didn't even have to give it wasn't recommended to give heartworm preventative except when you left. So like when I would take Phoebe to New York, the doctor would say, "Yeah, go ahead and start giving her heartworm preventative like the month you go and then the next month after." And we can explain why that is. Like what's the thought process of why you would still need to do it the next month. And so I would do that. I always had her on, flea and tick preventative because there are still fleas, obviously. Um, and I don't know about how many ticks. I don't really think I ever saw a ton, but I covered for it because I didn't want her to get any tick-borne illness. Do you see a lot of ticks?
Yeah. Yeah, we see a fair amount because like there's a lot of hiking around Southern California that do have a lot of ticks. So that happens, unfortunately, probably a little more all year long than maybe some other places, just because of
Actually, they don't die in the winter here. There that's a fallacy. I think we talked about that in another podcast one time, but they don't we see a lot of tick-borne illness all year round. And fleas too, even here in the frozen tundra of Indiana. Because of how variable the temperatures are, so we're up and we're down, we're often, freezing one day and then over 40 the next day. And so that's just not consistent enough to kill off fleas or ticks. And ticks can overwinter. They live in the colds. That's not they don't all die. And so you will still see them. And I have definitely had um really like dogs that people are like, well, they're hardly ever outside come up positive for all sorts of things. So, I mean, I think we've like I said, we've talked about tick-borne illness before, but I don't really think we ever nailed down heartworm disease per se. And
yeah.
um, it is such a preventable disease, and it is such a tragic disease when it happens because it is so hard on the dog, and cat. I guess we should even get into too.
Yeah, exactly. And I think, yeah, so I think we'll first start with kind of what it is. Essentially, it's just a disease transmitted often by mosquitoes to your cats or dogs. It starts off, it's a parasite essentially that can grow into, unfortunately, a very large worm once it's in your dog's or cat's blood system. And it likes to
And it
hang out.
very literally, the larvae swim through their blood and
Yep.
set up shop and home in their heart,
Hence
which
the
is
name.
never good.
Heartworm.
Yes,
So,
right.
just in case you're wondering where it hangs out and why God's name, that's the reason.
Mm-hmm.
So heartworm is, I'll say initially I saw it a lot in shelter dogs because they weren't on preventatives and the owner would adopt the dog. And unfortunately, they find out later that they were heartworm positive.
Mm-hmm.
And there's different degrees of when your dog will be heartworm positive. And there's different significances and severity of that process as well. When they're tiny little, I think it's dioflaria, is that what the name is? Or
Yeah, the
I
diarrhea is the larva that's in the blood. Mm-hmm.
Yeah, they're not as bad. They don't cause many problems. However, when you do treat for it, you still have to be careful. So we'll get into that. But
Yeah, and
um,
I was gonna say the thing is they can be heartworm positive and not be diarrhea. I cannot speak right now, but they will not always have the larva in their blood since my
that's
my words are not forming properly. So that is one thing. If your dog comes up heartworm positive, um, the reason they come up heartworm positive, and the reason why, this may get a little jumbled, I guess, but there is a difference between finding heartworm disease in a dog versus finding heartworm disease in a cat.
Yeah.
Because the test itself is a test that detects adult female worms. So you could have male one male worm in a cat that has set up shop in the heart, and because cats' hearts are very, very, very small, one worm does an enormous amount of damage,
Yeah.
but may not come up heartworm positive if you're testing for the antigen. So in cats, the test is actually an antibody test, but all that tells you is whether or not they were ever exposed. It doesn't tell you if they're currently um, infected at that moment in time. The worms will eventually die. So a male worm will die, and if there's no female or no larva to keep it going, they'll die off slowly. And in cats, there is no treatment. You have to just wait for them to die, which of course does a lot of damage to the heart itself while those worms die. And you can see in dogs and in cats, like secondarily, they can have signs of heart disease, like so cough and stuff like that. They can have also like an embolus, like a basically what's like a clot, but it's as those worms die off. So, I mean, there's a lot of things that can happen secondary to the disease, and nobody really thinks about it in cats. Like, it's such an afterthought. And part of the reason why is because we don't have a great test for it, and we don't really have treatment for it. And it's about like 25% of indoor cats in endemic areas have, I think is the last time it's been a while since I've looked that up, but that's been like what I remember. Like, that was a much higher amount than people realize.
Well, it's
And a
'cause
lot
they
of
don't
times,
realize that.
sudden death is how you find out.
I agree wholeheartedly because I don't think people realize that there's a reason we keep them on preventive. We'll get into like why they're on preventive,
Yeah.
but like a mosquito can get in your house very easily. I
Mm-hmm.
had them in my house even recently, and that's in San Diego. So like they can get in anywhere. And unfortunately, they're gonna hang out on your pets. Unfortunately, if they're affected, so will your pet be. And we don't think to test our cats very often because honestly, how many cats do you see that say, "Hey, my cat hasn't been to the vet in 6 years"? They're
Happens
indoor cats.
really often. Yeah. They're only indoor. They can't get fleas. They can't get this. They can't. It's like, no, they can get all of those things. And it is hard. I understand when it feels like the chance of them being exposed to it feels really, really low, right? And it seems like, well, I mean, really, what is the chances this is going to happen? And the amount of cost that it costs to actually keep them on preventative. Like, my favorite, revolution is the one that I like the best for cats. It's not cheap. It's really expensive. And so I think a lot of times people are sort of swayed by the expense of it, just because it's so rarely found in cats. But I've seen some pretty nasty, weird things in indoor cats that I'm like, if they had just been on preventative, this would never have happened. But it's like, it is. I do understand the struggle people go through, because especially if they have multiple cats or cats and dogs, and you just have and you want people to be able to have pets, that they enhance their life so much, but it is getting more and more expensive. So it's something that I do understand why people are sort of like, I don't really see the reason, but when it does happen and it happens to your cat, it's really tragic.
Yeah, and I think the one tough part is that you won't know until they have it, until it's kind of too late. It's kind of like one of those silent, I'm not gonna say silent killers because it's not necessarily
It
true,
can be,
but
though, sudden death. I mean, that is how some people find out.
exactly, like they
Horrible.
don't show signs in the beginning. Like they only show signs when they've had us like in dogs and they have a significant worm load in their
Mm-hmm.
heart and you realize that they're in heart failure because of all the increased worms in their heart affecting its right side. So it doesn't show up until it's too late at that point, unfortunately. So that's
Well,
why
in
it's
dogs now, I think with the routine testing every year, we will
yeah.
catch it um in a way we don't in cats. So that was my only sort of PSA for like cats. Like,
Yeah,
you don't
absolutely.
realize it, and what you're saying is totally true. With dogs, we've instituted such good testing protocols.
Mm.
And like, I know in my clinic, so if we do a 4DX test, right? So we're looking for the heartworm and the some of the tick-borne disease, which we talked about before, I think. And so if they come up heartworm positive, we actually send out a confirmatory test, right? So those are
Uh,
screening tests they're more sensitive, right? Because you don't want to miss anything that could be positive. Um,
Mhm.
and then we also check for dirofilaria. So, see, I said it right when I wasn't thinking about it too hard.
You don't think about it,
Um,
it's like,
yeah, and then you say it, yeah. And so certainly if we see the larva in the blood, then that we don't technically need to send out the confirmatory test because we know that it's there, right? Um, and then we do have to sort of deal with the changes in the protocol, a little bit of treatment versus when you have the dirofilaria and versus when you don't. And then I think the thing that is really important that people understand is that um, there's twofold problem with the treatment of heartworm disease. One is the expense. It's
um,
extremely expensive and it's
yeah.
not short. It is about a 4-month process, I think.
But I remember it being a long
Yeah.
process. And,
I mean, it's at least 6 before you can retest it, right? So like
yeah,
technically it's 6 months, but like the actual like hands-on, we are currently treating this dog for heartworm disease. Um, I want to say it's about a 4-month process. Um, and depending on like where I've worked, so like my previous practice, I definitely saw more heartworm than I see now. I think I'm at a practice where people are really good about their preventatives. Um, and now with some of the like injectable preventatives, which this current practice I don't have, my last one we did, and once we started really instituting that, that was great. We can talk more about what the different preventatives look like sort of at the end. But some places, and I think you mentioned like shelters being one of them. Sometimes just in places where maybe people just don't know, you know what I mean? Like it's not as common as just like part of something that you've done forever.
yeah,
Or like where people maybe like don't have as much money, just because it is an expense. But the heartworm preventative is not the most expensive preventions per month. Like it's actually pretty reasonable.
yeah.
Considering how expensive treating heartworm disease is. Do you know
Oh
how
yeah.
much it would be near you? Like, do you have any sort of sense?
For treatment of like heartworm positive,
Yeah, like, because you
I haven't
probably
seen
don't
it.
do much of it, do you?
No, I couldn't tell you the last time I treated a heartworm positive dog. It's
Yeah,
been a
just
long.
being an emergency because it's such a chronic thing that needs follow up.
Yeah,
Um, I'm gonna say on average, it used to be the last time I treated it, it was in the vicinity of about $1,200 for treating everything all together. I'm gonna say just with the way things have increased, it's probably closer to 1,500. I wouldn't even be surprised if it's more than that now.
yeah,
Just because everything is so much more expensive now that I keep being like, yeah, I think it's about 1,200. Then when I look, I'm like, oh, it's 15 or more. Because when you diagnose a dog with heartworm disease, like we'll send off the confirmatory test at no charge. Like we'll just do that to make sure. And then checking for the dirofilaria, like we don't charge for that either. It's just a quick,
yeah,
hey, let me look under the microscope. Let me see what we can do. Where it starts to get expensive is before treatment. What that looks like is we're doing radiographs, so 3-view chest rads, so the cost of that wherever you are. Because we need to look at the vessels, we need to look at the heart, we need to see if there's any, like basically what damage we can assess that way.
yeah.
And then blood work before putting them through the treatment, which frankly is just really hard on the dog. The treatment is it's one of my least favorite things to do, probably because of how preventable it is, and it's so not people's fault sometimes, like when they've adopted a dog or something like that, like they have no control over where the dog came from. And I adopted a heartworm positive dog once as well, and it's hard, but the medication you have to use when you finally get to the part of actually doing the injections, it's not a like it hurts. It's a not a nice situation, honestly. Um, but it's so necessary because you can't just let those worms stay in there because they damage the heart the longer they're in there. And I know some people advocate like the slow kill method. It's not advocated by the American Heartworm Association, at least last time I checked,
I was wondering about that. The slow kill method, isn't that involving just giving preventative
until they
uh,
die.
till they die?
Some people I think will also keep them on doxy the whole time in case well, there's a whole nother thing that happens. So actually the heartworms themselves um have a bacteria like the Wolbachia, and so when
Well,
yeah, you have to kill that because it can cause like a anaphylactic reaction as they start to die, and so you have to actually treat the dog with doxycycline before, like, for a month before you even start to do the actual injections. Um, and then there's like having them on a steroid as well, and then keeping them exercise restricted the entire time you're treating them because they
that's fun.
cannot get their heart rate up.
Yeah, and that's the tough part, just for like a young. Because I
Because
feel
it's
like the only
almost always these young, usually like these big pits, like, are so happy they want to run around, and the lab that I adopted, I mean, he just wanted to play, and be a lab, and he couldn't because he had heartworm disease. So, um, it's a really, really difficult treatment protocol. It is nice. There is a really good website for like when you have a dog that is heartworm positive. The Heartworm Association of America has, like, you can just put the dog's weight in, and it puts out the entire schedule of what you need to do, like get them on the
lines.
doxy. This is their dose based on their weight. This is the pred dose. Have them come back. Do the X-rays, do the blood work, and then evaluate it. Have them come back in a month, do their first injection. Then I think it's the I don't remember. It's the next day. I forget exactly when. It's horrible. I should have. Now I'm gonna look it up. Um, I've done it enough times, but usually I'm just like following the
Protocol.
guideline. You know what I mean? And it definitely it definitely makes it so much easier because it takes out any of the guesswork of it, and you know that you're doing like what's been recommended based on all the studies that they've done and stuff like that. So it is like a really, really helpful thing. I'll look that up real
Yeah,
quick. I'm
yeah.
curious.
It's
uh
just it's a tough disease to treat, and it's unfortunate that um, like I said, owners get stuck with it when they first adopt a pet. But it's a lot of time. It's tough on the pet, and really, I always have a hard time just them keeping it in a cage for a while because it's just most young dogs aren't going to tolerate their whining in the cage, and you give them sedatives while they're in there, and it's tough. So
oh
highly
yeah.
encourage. The reason we recommend the preventative that we do because we don't want you to go through it because it's a tough, long process on you and on them. So keep that in mind.
And I would say this is a really good website if people ever really just want to read about it, want to understand a little bit more about it. The American Heartworm Society. It's really, I mean, it has guidelines. It kind of explains everything, and it even has it in other languages too. So it's a really nice resource to be able to go to. And I always have a joke. I'm always like, well, I never memorize something I can look up because there's just not enough space in there at some point in time. But yeah, so we go ahead and we do this entire treatment course. And I will say that the injection that we use, the melarsamine, that is the adulticide, which is what it takes to actually kill the worms. And I guess I should explain why that even has to happen. So when you give heartworm preventative, you're basically just deworming the dog once a month.
Yeah,
And so, and most heartworm preventatives will kill the larva, so the diarrhea, and up till L4. So there's like different stages of the development of the heartworm. But once they get past the fourth, I guess it's like the fourth stage of the larval stage, so L4 being that, they're adults. And once they're adults, the heartworm preventative doesn't kill them anymore. So that's the problem. And so I think that where people get confused, they think like when they give heartworm preventative, they think like it lasts the 30 days. It doesn't. It is basically like a one-time dewormer,
yeah,
right? And so it also protects against like intestinal parasites. So it keeps your dog free of intestinal parasites. And
yeah,
it's done probably like the lowest dose that they need, but there's a range, right? Which is why there can be a weight range that's very safe for your dog. And
yeah,
it's been tested at like 10 times that. I mean, it's like you can give much, much higher doses.
yes,
And but then when you get to the point where the heartworm preventative doesn't work anymore, you need the adulticide, which is what that injection is that we give in the process of doing the heartworm treatment. And that has to be given in a muscle. It's a deep, like, intramuscular injection, and it is can cause a lot of inflammation and pain where you give it. So when I said it was a painful treatment, that's what I mean. It's not like painful the entire time, and it's not like pain like getting stabbed. You know what I mean? But it's just like it's a,
It's just
if you ever had like a really really painful deep
actually
muscular sort of ache, yeah, I think that's what it's like. And like we will give pain medicine with it, but it has to also be given along with prednisone. So sometimes like, you can't give some other pain meds along with that, and you just have to sort of
write it
just,
out.
yeah. And again, keep them calm and not let them play. And that's really, really difficult. And all the while, there's still some damage being done to the heart itself. So really, like, prevention is the name of the game. And I know, like, for a while, there was this stuff going around the internet that was like, oh, heartworm disease isn't real. I promise you it's real. I've actually seen heartworms. Like, they're not made up. I've seen a lot of larvae in the blood. So, I mean, it's legitimate. Um and it's something that it's really really like very preventable. One of the other things that I think people don't understand too is, so if they've had their dog off of heartworm prevention, and then they come in and they do a heartworm test and it comes up negative. So then they restart heartworm preventative, and then they come back, let's say 6 months later or a year later, and they're positive. They're like, well, I've been doing heartworm treatment since it was negative. So this must not work. And it's not that, it's that it takes 4 months for you to know if they're heartworm positive. And so let's say, you had a dog that was exposed, they were off of preventative, that worm became an adult, but you couldn't detect it either because it was male or because it just wasn't a fully grown adult female worm. Then you start giving the preventative, but it doesn't kill that adult worm. So it took all that time for you to get to the point where you could find that it was positive, but they were
Yeah.
already exposed before you ever even started treating, or preventing.
Yeah.
So um there are like the companies that make preventative. If you keep your dog on it all year round and you test every year, some of the companies will actually cover the cost of treating the heartworm, but you have to meet all their stipulations. And if you don't meet their stipulations, they will not pay for it, which we
Yeah.
have
Yeah. I
talked about
remember
before.
that from Park Guard, I think does that where
Yeah,
they'll
they do.
the cost as long as you have to make sure you give it every month. You have to have like proof of it and
Yeah, you have to
um
have proof that you've bought it in consistent enough measure that they'll give you the benefit of the doubt that you gave it if you bought it.
yeah.
But you also have to test. So, because we had one owner that happened, but they had declined the heartworm test the year before, so they didn't cover it. And you're assuming that they're telling the truth, give them the benefit of the doubt that they've been giving them medication, but the way that the company's gonna say, well, how do we know they
Mhm.
weren't already heartworm positive before you started giving the heart guard?
Yeah. And unfortunately, when you do a high enough worm burden, there's some other unfortunate diseases your dogs can get too. There's things like pulmonary hypertension, which is a side effect of having worms, and which that can be it is a life-threatening illness. Dogs with pulmonary hypertension just have increased blood pressure within their pulmonary artery,
Mm-hmm.
uh, and unfortunately, it can cause them to collapse suddenly. They have difficulty breathing, and once they're at that point, there's not a lot of like you can treat the disease, but the damage is already done. That can be a shorten their life significantly. If most of them are diagnosed with pulmonary hypertension, they're not going to be around for much more than a year. Um, so it's a tough disease. And then even worse is when there's such a high worm burden, there's something called cable syndrome, which is when there's such a high load of worms in the right atrium and the vena cava within your heart that unfortunately it can impair how the right side of the heart closes and put them into heart failure. And you actually need to go in surgically and remove the worms, which
Yeah.
is insane. Like I've seen
And
them pull
dangerous.
and
Yeah.
dangerous.
Well, because
So
you can't kill them off, right? So, like, if you gave them the malarcimine, the adulticide medicine, and they died and they stayed there, functionally they would stop the blood flow, and then the dog would die. So you have to manually take it out so that they can continue to have blood flow. I mean, in the right way. And then, But we were talking about ascites last week, and I was telling you like that's one of the times that I had seen
Yep.
ascites
Exactly.
with cable syndrome.
Yeah, it's I've seen like the procedure done like on multiple videos, and they just pull out these massive worms, and
Yeah.
it's insane. How
Yeah, if you
like
don't think heartworms exist, YouTube it.
yeah, YouTube it. Yeah, honestly, I guarantee you'll believe it
It's
very
there.
quickly.
Yeah.
Uh, Massive. So those are just the consequences of not one testing and two not keeping them preventives because it's just something that can get really bad very quickly. So it's definitely a disease that just regardless of what area of the country you're in, you should always test for and be on preventives. Like my dog's on it and he
Yeah.
hasn't seen it in a while.
Yeah. And I would say too, like I do think also things are changing a little bit too. Like we used to not have Lyme here in Indiana, but we do now. And so like you said you had a mosquito in your house. Like I do think that the map has changed a little bit where you do see a little bit more heartworm in California than, I did 10, 15 years ago when I lived there.
Yeah.
And so I don't know, I mean even you, Robert, have to ask your GP, whoever they are, if they're
I should
seeing
find
that
one.
now. You know what I mean?
No, I agree. Actually, that's yeah, it's something that's very, very it's important. And Loki, I will admit, has not always received his monthly heartworm the way he's supposed to.
Mm-hmm.
So you'll have to be back on that a little more consistently.
Yeah. Well, and I guess we can, talk about like so monthly isn't the only way now to do it. So, yes, you have your monthly heartworm preventative. It comes in like treat like choose, so something like HeartGuard, which a lot of people are very very familiar with. But then there's also now a lot of these like 3-in-1 sort of situations where like NexGuard and Simparica, like Simparica Trio has heartworm preventative and flea and tick preventative, and so does NexGuard Plus. 3-in-1 combination. I don't know if Elanco makes one yet, but I know I they know they make Trifexis, right? So Trifexis is an interceptor, maybe I think they have. Those are all oral. And then the Trifexis will also take care of fleas, but not ticks. So always look at what things are covered and make sure you're fully covered when you're looking at these things. And these are like a small sample set, and I'm not recommending one more than the other either. But there are topicals too. So Revolution is a topical that will do all three. Um, Advantage multi prescription again, but all three. And then there's injectable. So something like ProHeart, which is basically like a vaccine against heartworm, which is brilliant. And I think it works great.
Oh,
I wish I had it at my practice that I'm trying. I'm advocating for it, but I have not been able to convince the powers that be to get it. But at my previous practice, we had it. It used to just be 6 months, so they'd have to get it twice a year, but now it's a 12-month injection. And
that's
it
nice.
works really well. So if you are somebody who just forgets to give medicine, there isn't a solution for you, and that is a really good solution.
Yeah.
All they have to do is come up with an injectable for flea and tick, and then we're off to the races because you could just vaccinate your dog from everything once a year, which would be great. Hopefully
That's really nice.
one day it'll
Yeah,
be
good to
there.
hear
We'll see.
eventually. But that's actually really, I didn't know about ProHeart. And because I
Oh
don't
yeah,
do the preventive space at all, so it's nice to hear those options because
yeah.
I'll be doing GP work here soon, so I need to
ProHeart's great. When I have seen any sort of reaction to it, it's been just like what I've seen with vaccine reactions, and you pre-med them the same way, and they do really well.
oh
So,
nice.
so it's literally like a vaccine. It's a really good option, especially when compliance is a question. So, like if you're going to be pinch hitting in like vaccine clinics and stuff like that, where you just don't have the relationship to know if they're going to keep up with it,
Yeah,
it's very safe. I think there was some question for a little while because when it first came out on the market, before we were ever in vet school, like
yeah,
years ago, it had to be pulled because of something that happened. And then, but now that when they reformulated it and got it back through trials and everything else, it's been very safe. So
nice.
there may be stories out there people can, come
Hear
up with
about.
something. Yeah. But no, at this point it's very safe. Um, but yeah, I mean that's like a quick overview, I guess, on heartworm disease, and just really it is so preventable. It's not that expensive, and it's so hard on their heart, and it is so expensive to treat. My only PSA is please, 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 please keep your dog on heartworm preventative. I promise you it's a real disease. And it is something that you really should. Like, I always feel like in the spring we need to have these PSAs like preventative. I promise. It's really good.
I know that's a tough thing to because I do a lot more reactive medicine, and but it's all because preventative we're not following up with preventative care as much in a lot of cases. So it's very important. Highly recommended. Listen to Dr. Sam. She knows best.
I don't want to treat your dog for heartworm. Really, that's what it comes down to.
Or do I? So yeah, listen, it doesn't.
Yes, I want to keep them happy, healthy, and alive as long as possible. So that's our PSA. And this is the Heartworm podcast for this time for the Pause It podcast. But if you guys do have any questions, especially about like the different preventatives, or if you've ever seen things that, you know, you're like, well, my dog didn't react well to this, what other choices do we have? Certainly talk to your vet who knows your dog the best. But if you ever have questions for us, you can always email us at podcast@mybalto.com. And yeah, we love answering questions and dedicating podcasts to your questions. So yeah, this has been a lot of fun. I always like to get our chats, just me and you, every once in a while. So
It was
um
nice.
yeah. Well,
Thank you
thanks
for
everybody for listening. This has been the Pause It Podcast.
thanks guys.